What's going on, everyone? Happy Monday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test today or at some point over the weekend that just ended, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Monday edition of the Pandemic Update for Monday, September 16th, 2024. If you're new to my channel, maybe this is the first time you've clicked on one of my pandemic updates. Well, what we do here is I go over the latest COVID data and information for the United States and anything I can find from elsewhere in the world. We've been through a long summer surge. Summer is coming to an end, and thankfully, the summer COVID surge, it is dropping, but levels for COVID in the United States and other countries still remain high. In fact, in some countries, cases are just now going up, and they're seeing a surge of their own. So, want to stay informed each and every day of what's going on with COVID, flu, RSV, and all these other viruses. Yeah, that's right, I mentioned some other virus names because it's getting to be that time of the year. Fall and winter's coming in the United States. Colder weather months means more viruses will enter the picture. And, well, once we get towards winter, we'll probably have another round of COVID, another wave of COVID during the holidays. That's a little ways down the line, but today we have to go over the new numbers from last week from BNO News. Yes, another week with over 1,000 deaths. I'll give you that exact number in just a little bit. But first, if you're new to my channel, hit that subscribe button down below. Give this a thumbs up. Hit the notification bell. Share this video with anyone you know and leave your comments down below. Starting off today with just a little bit of data, some news, then the data from BNO News, and of course some of our daily stuff, and then we'll have new Walgreens data, and I think we will get to a few more wastewater sites today as well. So starting off with New Zealand, which is what I like to do on Mondays, but as of lately, there have been some Mondays where they haven't updated, and unfortunately, I went right to the source. I went right to New Zealand's dashboard because I wasn't seeing any news stories, and unfortunately, these are the same numbers from last week. The new case average last week was 136, and on last Monday's update, they had 82 people in the hospital for COVID. This is for COVID now, as of midnight Sunday night, and deaths attributed to COVID, they had 3. Their total deaths because of COVID from the start of the pandemic is at 4,421. All right, moving on to this. This is not good. Asthma and lung disease rates skyrocketing in New Zealand, and it says 1 in 5 New Zealanders are now affected. And we do know, matter of fact, I just added a study to my site, datareport.info. It's from the beginning of this year that states, hey, COVID can attribute to onset asthma. It can cause asthma, and I myself am one of those people. Prior to having COVID in early 2020, I never had asthma. And I mean, I had some coughing, but nothing like now. And it has gotten a little bit better because I have treatments now. But the point is, I never had an asthma diagnosis prior to having COVID. And I never had shortness of breath issues prior to having COVID, which were really bad before I started receiving treatment. So yes, as you can see here, this is not good news. And New Zealand's not the only place that's having these type conditions skyrocket. It's probably happening in other places around the world. We just haven't heard reports about it. I'm sure in time, as time goes on, we will. Lung diseases, that can also happen because of COVID as well, but it can also happen for other reasons. Are people smoking cigarettes? There's a lot of different causes. Bad air qualities. Some people get allergic asthma. That's what mine's deemed to be. I'm apparently allergic to something in the air that causes which ones it is, I don't know. That's still a mystery. All right, moving on to this. In the UK, yes, in the UK now, we've been talking about mpox lately, and there has now been, let me find it here, there has now been an order for mpox vaccines. Yes, they are ordering the mpox vaccine in the UK, and they're ordering 150,000 doses. They're preparing in case of there being an outbreak of mpox in the UK. So I think this is important that they're taking this measure ahead of time. And if you're in the UK, and you qualify for the vaccine, I don't know what the requirements are over there. It's probably different in the US, but if you can get it down the line, hey, consider doing so. It's not a bad idea. Keep yourself protected from mpox. Whooping cough virus now in the United States, specifically in Jefferson County, Wisconsin, is on the rise. It says here Jefferson County Health Department reports increase in whooping cough. Now, I've looked at multiple different articles for this, and it doesn't state precisely how many cases they have had there, but it just says, at least in this article, Jefferson County health officials are reporting Monday that they have noticed an increase in whooping cough cases over the past month. So, not good, and as you know, in Portland, Oregon, there has been a whooping cough outbreak with their football team. And I did see an update for that today. They're hopeful they can play their next game on Saturday. But as you know, what's happened with COVID, they're saying, oh, they'll be good to go within 5 days. You know, the rush. All right, moving on to this. This is relatively important. This is something we look at each and every week. This is numbers put out by BNO News. They compile all the state data, and then they put it all together and get total number of cases of COVID, number of people in the hospital, number of new deaths, all of that. So weekly U.S. COVID update. New cases, 150,210. Remember, all of these numbers are likely underdone, especially the cases. The average is 166,986. That is dropping, which is some really good news. That's down by 4,752. In the hospital, that's actually up by 3, which is not a big deal, but up is up. 5,299. In the ICU, 625. That's up by 5. New deaths, 1,232. That's down from last week. Average is 1,281. Now, I want you to take note of something here. Notice again, 5,299 people in hospital, 1,232 deaths. Well, if that was the actual number of people in hospital, which it's not, mandatory reporting is starting back in November, but if that was the actual number, well, heck, that's a lot of deaths for 5,299 people in hospital, which just goes to show you how underreported hospitalizations are. Who knows where we'll be? We'll probably be still in between waves on November 1st, maybe at the early stages of something rising once again. But the point is, with this many deaths, there is likely a lot more hospitalizations that we do not know about at this time. And if that was the real number, well, heck, that is absolutely horrible. It's not. We're going to see the numbers. We're going to see a better picture of what's going on. Maybe not the full picture, but a better picture of what's going on come November. They say the COVID summer wave continues to ease with another drop in new cases, even though deaths remain above 1,000 for the 5th week in a row. And I'm going to add something here. You have to remember, deaths are the last lagging indicator. The only other thing after that comes the increase in funerals, which happens a few days after deaths. But yeah, and I have been seeing a big increase in the number of funerals over the past couple of weeks. I've been seeing funeral processions. I've been seeing people coming out of viewings. I've been seeing people at cemeteries for burials. Yes, it's very noticeable, which right away tells me that this number is underreported. Only 33% of hospitals in the U.S. submitted COVID data this week, down from 91% in early May. This means actual case numbers and hospitalizations, as I said, are substantially higher than reported. This is the 5th week in a row with more than 1,000 new COVID deaths in the U.S. It's also the 235th week in a row with 400 plus deaths, or 1.2 million deaths total. So far this year, nearly 5.3 million COVID cases have been reported in the U.S., causing at least 362,954 hospitalizations with partial data. So that is a significant number, even without all hospitals reporting, and 41,350 U.S. reported deaths. So again, some significant numbers here. And again, if I had the comparison for flu, COVID blows flu numbers away in terms of deaths and everything else. All right, on my website, I just saw this posted right before I was about to record, so I figured I'd share this. This is from Steve. It says here, summary, COVID variant XEC identified in the country of Germany in June of this year has seen growth in Germany and other countries such as Denmark. It appears to have a slight transmission advantage over other recent COVID variants, although whether that advantage translates into XEC becoming the eventual dominant strain remains to be seen. And I agree, and I also should probably add, I would like to add with this, that from what I'm seeing right now, and I've seen a few different things, it looks like XEC may not be all that much different from KP.3.1.1. I'm also seeing there may be other variants out there, so we'll have to see. I'm not 100% certain what's going to be the dominant variant come around the holidays, December, early January, but right now, a lot of buzz is happening with XEC. The good news is it may be similar to KP 3.1.1 in terms of severity. It just may be a little bit more transmissible. Only time will tell, and of course, if I find anything more about that, I will let you know. Not much else to talk about on the website today. Moving on now to some of our weekly data, actually. This is a weekly product that we look at, and that is heat-related illnesses. Hopefully we can get this to come up. It froze up on me earlier. And wow, really good news. This is definitely updated. A lot less counties in the United States. I mean, Florida's still bad. The western U.S. is still bad, but overall, nationwide, the number of counties that are dealing with heat-related illnesses right now does appear to be down somewhat, especially in the Great Lakes region. So that is some good news. And it says here, the number of heat-related illness activations, I believe this is over the last 14 days, looks like it's down 51.5%. So that is some good news. Remember, I'm seeing this for the first time as well. Let's take a look at the pollen levels for today. 40% of the country is in medium status. You can see there is red in Texas, red in Oklahoma, some red in Louisiana, Arkansas, and also in New Mexico, and even portions of Kansas today. The rest of the country is not doing all that bad. Air quality levels for today. Let's refresh this, see where we stand on that. Wildfires continue to be a problem in the West Coast, but it does appear they're finally getting a little bit better, which is some good news. Taking a look here in the southeast, southeast and about the Great Lakes on northward. Still a few problems. I think that will improve in the coming days. You can see the immediate east coast. It's not terrible because you have a flow coming off the Atlantic. You have some rain that is coming into the Carolinas. That should make things better. And some of that rain will get at least up to about Pennsylvania. So that may help cleanse the atmosphere. Want to learn more about weather and climate and what's going on there? Go over to my X account, Climate Data Report for that. Taking a look at Philadelphia EMS calls yesterday. 835 EMS calls were reported. Live looking at Montgomery County, Pennsylvania. Let me refresh this. No, that's correct. Wow, a lot of calls right now in Montgomery County, Pennsylvania. You can see stroke, cardiac emergency is showing up multiple times, respiratory emergency, vehicle accident, all kinds of stuff going on right now. Hopefully less busy over in Chester County. Oh, something I don't like seeing. Not one, not two, not three, but 4 sick person calls right now. That's not a good thing. That means there are people sick, and sometimes that could be miscellaneous. That could be maybe someone has cancer. Maybe someone has a cold, flu, COVID. I mean, there's a whole bunch of reasons why a person could be sick, but we've been seeing quite a few of these calls lately, and that's not a good thing to see that many of those type of calls. Taking a look at what's going on in Canada. The viral COVID activity level is moderate. Flu A is low. Flu B is low. RSV is low at this time. All right, we're just going to look at a few Walgreens states here because I did want to do a few wastewater sites, and, well, we're getting pretty long with this video today. National positivity trend for Walgreens is at 26.2%. The prior week is at 29.9%. That's a difference of down 3.7%. Total tests. This actually went up. I'm surprised about this one. 10,996 tests, which is higher than 10,030 tests reported last week. For the most part, you can see here, there's a lot of green. We're trending in the right direction. But there's a few areas that are red, so I suspect we should take a look and find out why. Massachusetts, the positivity trend is 27.3%. The prior week was 16.7%. That's a difference of up 10.6%, but I have a problem here. Take a look. There's only 11 tests versus 6. You're not testing enough, so clearly, yeah, there could be a rise, but you're 11 tests. Come on, more people need to go out and get tested. Missouri, what's going on there? Well, Missouri, you do have a fair number of people getting tested in. Well, your positivity rate still went up. 29.2% positivity rate versus 24.9%. Difference of up 4.3%. Total test 312 versus 229. Yeah, unfortunately, that is a legitimate rise. Michigan 33.9% versus 30.5%. And that's a difference of up 3.4%. For some reason, you also did more testing, so it's a legitimate rise. And it's a good bit more testing. 304 tests versus 197. Iowa, 32.3% versus 29.8%. Difference of up 2.5%. 62 tests versus 47. Taking a look here at Utah. Utah, 35.1% versus 29.8%. Difference of up 5.3%. Total tests, 74 versus 57. And we'll also take a look at Texas. And we'll do some more states again tomorrow. Texas, 21.7% versus 25.6%. That's a difference of down 3.9%. And total tests, 1,816 versus 1,849. All right, the latest variant that is dominating is the KP 3.1.1 variant at 52.7%. Now let's just take a look at a few of these wastewater sites. And I did want to take a look at Stamford, Connecticut, just to see what's going on here with COVID. Stamford, Connecticut, you are dropping. Now it's slowed off a little bit. So overall, you are dropping, but it's not happening relatively fast. But you are dropping for COVID. The other viruses aren't much of an issue at this time. However, norovirus, and we're starting to see this at quite a few wastewater sites. Norovirus is starting to become on the rise once again. And to be fair, we'll just look somewhere real quickly out on the West Coast. And let's see what's going on. Now, we can't do San Diego. Can we come up here to see what's going on in Sacramento, California? Let's see. Sacramento, California. All right, look at this. You're starting to see a significant drop for COVID at this time. And yet again, the other viruses aren't much of an issue. A little bit of a rise for influenza A. But yet again, norovirus is starting to rise in this area. And how about mpox? No detections of that at this time. All right, taking a look at New Jersey for today. Only 58 out of 70 hospitals reported, and that totals up to 393 hospitalizations, 12 people on a ventilator, and discharges, 52, and in the ICU, 55. I would assume when we get the mandatory reporting again, it's going to be back to 70 out of 70 every day on November 1st. But what do I know? We'll have to wait and see. New York State, next picture here. You are dropping, but now all suddenly, once again, it looks like New York State, it has slowed down. In fact, last week, if you totaled out the cases, I think it was slightly higher than the previous week. And the number of people positive on the most recent update, 1,654. I'm hoping that when we get an update again tomorrow, we'll start to see this drop once again. Hospitalizations continue to drop. And I'm being very hopeful and confident New York State can get below 1,000 hospitalizations at some point this week. Only time will tell. 1,035 people in the hospital, and in the ICU, that is 119 at this time. Alrighty, folks, that does it for the Monday edition of the Pandemic Update. Reminder, my website is datareport.info. It's free to become a member there. You can sign up. You can start joining in on the conversation. Maybe you want to add something to my archives on there. Go right ahead and do so. Of course, subscribe to my channel down below here. Give this a thumbs up. Hit that notification bell. Share this with anyone you know, and leave your comments down below. A quick note about comments. I may be slow to approve them this evening because, or respond as well, because I'm going to be going out working, doing my delivery job this evening because, well, it's football evening around here. I suspect it's going to be busy this evening. So if you don't see your comment, I will eventually get to approve it at some point this evening or tomorrow morning. Thanks for watching. I'll see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Monday evening.